A very good morning to all. Today we are going to study another topic, that's abortion. What does abortion means? Legally, what is the definition of abortion? Legally, abortion is premature expulsion. Whatever the content of the uterus is, whatever that baby, what how much of age, how much of intrauterine life he has survived or not, how the premature expulsion of the expulsion of the content of the uterus out of the mother's womb, mother's body, before completion of the pregnancy, before completion of term. As we know, the total term is about 37 to 42 weeks. What is term? What is term pregnancy? Term pregnancy is from 36 to 42 weeks. Actually, 41 weeks, but in some books it says 42 weeks, in some books it's 41 weeks. We'll take an Narayan Reddy, that is 36 to 41 weeks. There could be two two types of abortion practices. I'm not talking about abortion types, I'm talking about abortion practices. What does abortion practices means? Abortion practices, that is how we are doing the abortion. It can either be a medical abortion. What is medical abortion? What does medical abortion, as the word signifies medically, that it is medically safe to do the abortion. What is medical abortion? Medical abortion implies that the abortion taking place before the liability of the fetus. Abortion before viability, when the fetus become viable, that is less than 28 weeks. The fetus becomes viable on 28 weeks of the pregnancy. So abortion before less than 28 weeks or before 28 weeks is known as medical abortion. And what is legal abortion? Legal abortion means the abortion which is legally safe. If medical abortion is the abortion which is medically safe, then legal abortion is the abortion that is legally safe. Legal abortion. So abortion done at any time of pregnancy. Any time of pregnancy, no matter whatever the gestational age of the fetus is or not, abortion at any time of pregnancy is legal abortion until or unless you follow MTP Act procedure. MTP, if you are following MTP Act procedure, the procedures given under the MTP Act, if you are following those procedures, it is legally safe abortion. Now we are going to see abortion types. We have seen abortion practices. Now we are going to see abortion types. How many types of abortion? There are two types of abortion. Abortion types we are going to see. There are two types of abortion. First is induced. Induced abortion means we are inducing the abortion. Second is natural abortion. What is natural abortion? Natural abortion, naturally occurring abortion. Naturally occurring because due to some chromosomal disorders, chromosomal abnormalities, or whatever it is, some chromosomal disorders like anatomical effects, defects, and hormonal problems. These could be the natural reason causing the abortion. So these are known as natural abortion. This is the most common type of abortion which is occurring in India. Most common type of abortion, because some due to some chromosomal disorder, because due to some complicacy in the pregnancy, Whatever may the reason is, the abortion occurs naturally. This is the most common type, and this is obviously not punishable because it's occurring naturally. We are not doing anything in it, so it's not punishable. Obviously, induced abortion. Induced abortion can be of two types: legal or illegal. Legal and illegal. What is legal according to MTP Act? What is illegal not according to MTP Act? According to the guidelines of MTP Act, and not according to the guidelines. That's it. Illegal abortion was also known as voluntary miscarriage. Voluntary miscarriage. For that illegal abortion or voluntary miscarriage, we have to learn some of the legal sections we have to learn. What are the legal sections? Legal sections related to the voluntary miscarriage. First is we have to learn three: 88, 89, 90 BNS. 88, 89, 90 BNS just tells about the legal section for the voluntary miscarriage. So now the point comes is, what are these legal sections? First of all, 88 BNS states that if the voluntary miscarriage, if the illegal abortion or voluntary miscarriage is occurring due with the permission of a female, with the permission of female or mother, whatever we want to say, if it's occurring with the permission of the mother, it comes under 88 BNS. If the 89 BNS states that if the voluntary miscarriage without the permission of mother, mother does not give the permission and still the abortion is taking place, it's under 89 BNS. What does 90 BNS states? 90 BNS states if the abortion is occurring and the woman or a mother dies. If the mother dies during abortion, it comes under not legal abortion. It's not under legal abortion. If mother dies during voluntary miscarriage, it comes under 90 BNS. But due to some procedure complicacy or whatever that is, if the mother dies, it comes under the 90 BNS Act. Second most important topic of this abortion chapter is MTP Act. What is MTP Act? MTP was firstly announced in 1971. MTP Act, Medical Termination of Pregnancy Act, was first launched in 1971. Then in 2021, it was again re-amended. It was some amendment, some slight changes were made. So that was known as MTP Amendment Act 2021. So we are going to study both of them. MTP Act or MTP Amendment Act. Amendment Act. It was in 1971 and it is in 2021. That's it. That's the first line of the MTP Act and MTP Amendment Act. In this act, according to this act, what are the indications for doing a medical termination of pregnancy? What are the indication? What are the conditions in which we can do the medical termination of pregnancy? First is therapeutic. Therapeutic, what does therapeutic means? If the mother's life is in danger, इफ माँ की जान अगर खतरे में है, इफ वी यूज अ स्लाइट हिंदी लैंग्वेज, इफ माँ की जान अगर खतरे में है, बच्चा अगर पैदा होता है, बच्चा अगर उसके पेट में रहता है और उससे माँ की जान को खतरा होता है, तो अपन एमटीपी एक्ट कर सके। इफ मदर लाइफ इज इन डेंजर, इफ मदर्स लाइफ इज इन डेंजर, it is therapeutic condition. Second is eugenic. What does eugenic means? Eugenic means if there is any risk for infection, if the baby has got any infection, has got any abnormalities, has any mental defect or physical defect. Why does it this occur? If the mother has come across torch infection, torch infection, torch infection, or any communicable disease, or any teratogenic agents. If the mother has come across any teratogenic agents, the baby will be abnormal. Baby will be physically abnormal. Physically abnormal. So we can do medical termination in that case also. Some like social. What does social means? If the failure of contraception fails, condom break, if there was a break in condom, breach in condom, if IUD does not fitted, maybe there was n number of cases due to failure of contraception. This is failure of contraception. We also have heard many cases like the contraception has failed. And the most important is humanitarian. If the pregnancy is due to rape, incest, or any sexual offense, we can do the MTP act. If the child is the pregnancy is due to rape, if is the pregnancy is the end product of an incest, if the pregnancy is the end product of a rape, the MTP can be done with the consent of the female, depending on the age. Then, what are the criteria and what are the types of the MTP according to the new MTP Amendment Act 2021? This is the pregnancy. This is 28 weeks. We know why 28 weeks is important, because here the fetus is viable. Okay, so we are taking 20 weeks. First 20 weeks, let's say 30 weeks or 24 weeks. Let's say 24 weeks, and then term pregnancy. Term pregnancy. Now we want to do abortion. What all are the criterias and what all are the indication in which week we can do the abortion? First of all, from the starting of the pregnancy till the 20th week, we can do abortion because of the failure of contraception. Failure of contraception. With also all of the indications we have mentioned, also, but most commonly, failure of contraception in first 20 weeks. After 20 to 24 weeks, between 20 to 24 weeks, it can be done due to if humanitarian action was there, means if rape or incest or whatever was there, if child has any abnormality, child is abnormal, mentally ill, has any physical deformity, has any chromosomal abnormality, whatever the reason is. Okay, if there is a mass disaster, if there is mass disaster time and the lady was not able to come within the 20 week, so a doctor cannot deny the patient that he will not do an MTP because of a disaster time, in during disaster time. Okay. After 24 week till the term pregnancy, if a doctor finds out the child is will be gonna an abnormal child, either mentally, either physically, either chromosomally, whatever that is, only on that case, only and only on that case, the MTP can be done after 24 weeks. If the fetus, a baby, is abnormal, after 24 weeks, only then the MTP procedure could be done. What will be the conditions for doing an MTP act? Now we are going to take this chart again. Also, these timeline are going again. This is the start of pregnancy. This will be 20 week. This will be 24 week, and this will be the term pregnancy. If we want to do an MTP between one first day to the 20th week, we will need one doctor's opinion. Only one doctor's opinion will be needed. One doctor's opinion should be enough for that. But if we want to do between 20 to 24 weeks, there must be two doctors opinion. Minimum two doctors opinion should be there. Two doctors opinion should be there. And for 24 to term pregnancy, that is the most complicated abortion, no doctor, you have to get the medical board approval. You have to get the approval from the medical board to conduct an MTP after 24 weeks. There is no doctor that can give opinion on the MTP and consult for MTP after 24 weeks of pregnancy. Then we are going to learn about the topic qualifications. What are the qualifications of a doctor who can do an MTP? Are you a doctor? You are also a doctor. You are going to be a future doctor. Are you able to do an MTP? No. Why? Now we are going to learn about those qualifications. What is needed for MTP? First, he or she should have PG or a diploma degree in OBG, obstetrics and gynecology. It should have minimum to minimum 1 year experience in it. 1 year experience in OBG. Or he or she should have minimum 6 months of residency. That is internship. Internship in OBG. Or he or she should have done minimum or assisted more than 25, more than equal to 25 MTP, out of which 5, minimum 5 MTP he has done, he or she has done individually. If these criteria are out, any of if these qualification criterias are fulfilled, out of any four of these criterias are fulfilled, he or she can do the MTP. And then the most important thing, consent. We are going to learn about consent. Who can give consent? This is the most common thing. A, a child, a woman more than 18 years can give the consent for his MTP. If there's a girl, if a minor is there, if a minor got pregnant due to any rape or incest, whatever that is, if a minor girl is there, the consent of a guardian is must. Is must. Guardian consent is must if the girl is minor. Husband's consent is not at all required. Husband's consent for an MTP is not at all required. The girl can do an MTP without husband's consent. That was all about abortion. I hope you have learned something new. I hope you have got memory brushed up, memory. If you have gone read through, revised, whatever you have done, maybe I was successful in that. Thank you very much. That's all.